What do you think is going to happen when you have all of these people coming into the hospital with all of these issues and you don't have the doctors anymore? You can't, there's no
We're
such
there.
free
We're already
healthcare.
there. We are there. People don't understand this, that my field, primary care, you have to be out of your mind to go into it. Across my career, 30% of what I did was for free across my career. And now, like I told you, it barely covers my cost of running a practice, barely, unless you work incredibly long hours where you're working 6 hours after office hours where you can start to make some living. It's like I said, if you're a plastic surgeon, it's 1,000 times better, and at minimum 100 times better, and many subspecialties 100 times better. So who's going to go into these fields? Well, I think it's actually been designed that way. I think they're trying to push physicians out so they can use something called physician extenders, which are nurse practitioners and PAs and things, who are actually quite good these days. But when I remember I was sitting at a round table, I did CNN for 10 years and was at a round table with Anna Navarro and Anderson Cooper. And I used the term physician extenders, and they all went, "Oh my God, what are you talking about?" I said, what am I talking about? You're not going to see a doctor in the future, because the doctor is going to sit 3 rows back and administer over dozens of other people who are actually doing the work. And of course, it's impossible to do that effectively. Again, this is all fantasy in terms of what good healthcare is.
So when you talk about it's a necessity because there aren't enough doctors, is what you're saying.
I'm saying the market forces they put in place, you're gonna have primarily physician's assistants and nurse practitioners and not doctors, because why would you go into these fields? You just wouldn't do it. Why would you train for 16 years to go into something where you can barely make a living? It makes no sense. Now, my hope is that what Oz is doing in terms of his suburban or rural care, that $50 billion, I think that's going to entice primary care people out into the rural areas where they could make a living, possibly. He understands, he's been practicing medicine as long as I have, and he understands so many of the problems in this system.